So hello everyone, good afternoon. I hope I'm live right now. Right, so I think people can see me now. So first of all, big congratulations to Dr. Mudgil and the team for organizing this Harcon once again, especially in this tough time for everyone, Corona period time, and getting hundreds of people on, thousands of people on online, and having so many lectures of different speakers on different topics. Um, it's a good time for everyone to learn, actually, to improve their skills. So big congratulations to them, and also thanks to them for inviting me to be a speaker. So today we are going to talk about PNF approach in sports rehabilitations. I think some of you might have attended my previous lectures on PNF approach, but it's especially today for the sports, how it can be used in the sports. So first of all, I just want to introduce myself. I'm Dr. Rohit Gupta, working in as a director of Australia Clinics in Gurgaon and Delhi, and I'm a founder of Movement Science Academy, which runs the courses all over Asia. So when we talk about the PNF, the first thing whenever I go and I teach in Mumbai, Pune, anywhere, and I say what is PNF, and the people comes with the idea that D1 and D2, and so I said, what's that D1, D2? This is, sir, we have learned this pattern D1 and D2. And so I said that, can you tell me how do you use it clinically? So what is the clinical relevance of this D1 and D2? And there they struck. Some of them they are being practicing PNF since long time. So the first thing I want to tell you today is that PNF is not just patterns. It's much more than patterns. Yes, patterns are there in the PNF. When we talk about the movement patterns, these are the basic human movements which are present in our body. So like I will give you an example for the same. But PNF is much more than that. We have certain techniques in the PNF, we have philosophy of the PNF, we have methods, we have tools, and then we have movement patterns where we work together. So if I talk about the movement patterns, how these had been discovered, why we need to train the patients or train the sports athletes into the patterns, from where these patterns have come, we need to learn this. So suppose some of you must be driving the car, many of you must be driving the car in the morning itself. So when you take the car seat belt, you put this way. So how do you put the car belt? You put this way. It goes in the diagonal, right? When you eat something or when you drink something, our hand goes this way. But if I extend my elbow, this goes to my flexion, adduction, extension pattern. At the same time, suppose you want to comb your hairs, or suppose you want to lift anything from the up, or you want to lift anything, you want to pick up something. So there are a number of activities. I would say 70 to 80% of the activities which we do in the daily living comes in the diagonal patterns. I'm not saying 100%, but most of the activities comes in the diagonal patterns. Now, there is a scientist before, he said the brain knows nothing of individual muscle action but knows about the movement. So suppose somebody comes to me with the shoulder pain, with the tendinitis of supraspinatus or any other muscles. Yes, I can work with the right needle, I can work with soft tissue bleach, I can work with many techniques which are so good to work on those particular muscles. But when we talk about the performance level, it's not just the single muscle which work, it's always a group of muscles. And that's what we do in the PNF. We always target on the group of muscles. So there have been many definitions of the PNF. One of the definitions of the PNF is that PNF is a set of stretch, which is used to improve range of motion. Then we have a definition of the PNF that PNF is a motor learning approach to develop neuromuscular control, training to improve maximum muscular contraction. So there are a number of definitions of the PNF which you can read out and which is being applied on all the patients. Now the scope of the PNF is in, when we talk about that, the people again have a myth that it's being used in neurological patients, but it's not like that. Definitely we use in the neurological patients. We use in the stroke, GBS, Parkinson, in upper motor neuron, lower motor neuron, but at the same time, we use the PNF in orthopedic, we use the PNF in cervical radiculopathy, we use the PNF in low back pain, we use the PNF in frozen shoulder, we use the PNF in knee pain. We have different patterns for the same. At the same time, we use the PNF in the sports rehabilitation. So At our clinic, we have been working with a lot of tennis players, footballers, cricketers with the PNF. Because all of them, irrespective of neurology, orthopedic or sports, all of them, they need the neuromuscular control. And PNF is such an approach which works on the principle of motor learning and motor control. So we look for the long-term results, and that's why we work with the PNF with them. I'm going to show you some examples today. I'm going to demonstrate 4 techniques today to you with some patterns. So 4 of the techniques I'm going to demonstrate on my therapist. But before that, I just want to tell you, like, when we talk about the recovery at the sports level, at the athletes, when we talk about the recovery, we have 3 levels basically. The first thing we talk about recovery at structural level. The second we talk about function level. The third we talk about participation level. Now, what is recovery at structural level? If somebody comes with a pain or difficulty in performing their task or like in playing, when we talk about like working on the muscles or ligament on the fascia, it's all about recovery at the structural level. We are working on the particular structure. When we train them for different activities, when we ask them to perform like dynamic mobility exercises, exercises with the ball, Swiss ball and all those comes in the functional level. And the third level is the participation level, when we actually take them to their normal playing level and we help them in the same. So like there are some tennis players which comes to my clinic from some academies, and when they play the double-handed backhand in the tennis, and when they feel the pain in the shoulder area or something, so sometimes we train them at the ground also. We work on their bilateral patterns, upper limb patterns, and we basically works on their performance. So that's the participation level. So these are the levels where we work in the sports with the PNF. Okay. So again, now I want to go for like some of the principles and the procedures before we go for like uses of the PNF. I'm not going to take much time. But the first thing we talk about is the tactile stimulus. So that's very important. Now, what is tactile stimulus? The way we touch our patients is the tactile stimulus. So we always use this lumbrical grip in the PNF. We use this lumbrical grip. We don't use mass grip in the PNF. We use this lumbrical grip. And it should be against the direction of the movement to create the resistance. So lumbrical grip comes in the tactile stimulus. Then we talk about verbal stimulus. That's very important. Why so? Because first of all, you have to teach your patient what you are going to perform with them. So activation, correcting command, preparation, all comes in the verbal stimulus. So that is the part of the treatment. The third thing we talk about visual stimulus. So keep the goal in the vision. That comes in our verbal stimulus. Now visual stimulus. Now why it is very important? Because whenever you look at the movement, whenever our patient look at their movement, suppose they are doing this movement, and when they look at their movement, they are going to recruit more motor units. It's activation of more motor units. But at the same time, if they are not looking at their movement, they're not going to be the activation of more motor units. So suppose if I create a resistance from the top, and if the person is looking at the arm, he or she will be able to resist or hold their arms against the resistance. So visual stimulus is very, very important again. Then we talk about body mechanics. Now, what is body mechanics? All of you must be going through the biomechanics, of course, the study of the joints, the motion, and that's very important as a therapist. But the body mechanics is all about position of the therapist in relation to the position of the patient. That's very important. It's not about just PNF. Even if you're performing some other movements, like if you're doing manipulation, if you're doing manual therapy, Mulligan, Maitland, your position matters a lot. The force from where it's coming, from your body, from your shoulder, from your arm. So body mechanics is very important, and that's what we take care in the PNF actually. After body mechanics, we talk about the resistance. So we always use optimal resistance in the PNF. So resistance is used to strengthen the muscles, of course, but optimal resistance means the resistance which is enough for the purposeful movement. If you create a very heavy resistance, that might lead to the fatigueness of the muscles. So optimal resistance is very, very important. Then we talk about traction and elongation. The traction is given to the joints before we start any pattern with our athletes or any other patients. Then we talk about elongation. Elongation is kind of a pre-stretch of the muscles again before we start the movement pattern. Then we talk about approximation. The role of the approximation is to develop is to facilitate the stability and the movement. So I think you must be knowing approximation all about joint compression, and that's very important to work with again. And then of course we have pattern. Now what are these patterns actually? So these are the three-dimensional movements which are present in human body. Like I gave you some example that when you comb, when you dress up, when you eat something, when you put the car seat belt. So most of the activity you do in the diagonal pattern. So these are present in our human body. We have not got these patterns from other universe actually. So these are the movements where we need to look at and we need to relate to our athletes. Now I give an example. Suppose I have a fast bowler or I have a spinner bowler, and he or she develops the pain in the shoulder while throwing the ball. The moment they throw the ball, they come after, like if I take example of the fast bowler runs. The moment they leave the ball, they throw the ball in the stance, they come in the stance and they throw the ball. The arm goes down into the extension, adduction and interrotation. The moment they throw the ball, and that's my PNF pattern. Sometimes these are not complete pattern, but these could be the modified movements into the patterns, and I need to relate that. So suppose my the cricketer comes to me that, sir, I have a pain in throwing the ball. So rather than working on the single movement of the abduction or adduction or extension flexion, I would like to work on the complete pattern. Why? Because that's how they have been training themselves from beginning, and that's like a motor development to the brain. That's the feedback to the brain. It's all about motor learning and motor control. So it becomes very important to train them in these patterns actually. At the same time, if a badminton player or a tennis player comes to me and say that I have a problem in serving or playing the volley, so that's how they play the volley or they serve, and the pain is there in the shoulder. So we might need to look at the stability part, the neuromuscular control part, and there we work with the stabilizing reversal technique of the PNF. We use the combined patterns of the PNF as a dynamic reversal, and that provides them a lot of stability and intermuscular coordination improvement, and we can work with the patterns with them. At the same time, if a footballer comes to me and who has a problem in kicking the ball actually, so so what we can do with them is that we can work with the flexion, adduction, extension pattern of the lower limb, and that leads to so good improvement in their coordination of the leg and improves their performance. Now if I talk about golf player or the tennis player again, or the golf player, they use their trunk a lot because they take a back swift and then they put it. So they use their trunk muscles a lot. I might work on their pain with different modalities, electrotherapy or manual therapy, but at the same time I need to work on their stability. To work on the stability for the core facilitation, we have bilateral patterns of the PNF, which originates from we have chopping and lifting patterns, which are being started with the bilateral upper limb and ends with the trunk patterns. And by working with the chopping and lifting patterns and creating intense resistance, I can reinforce with the irradiation principles. I can reinforce upper back, lower back muscles. At the same time, I can reinforce the abdominal muscles. So there are many ways to work with different sports player, working on their performance with the PNF, neuromuscular control. Now I'm going to show you 4 things. There are hundreds of tactics we use in the sports rehab in the PNF, and we have been working with wrestlers, shortboard player, tennis player, cricketers, again badminton players, but I'm going to show you 4 techniques, so let's go for it. So I'm going to show you, first thing is the stabilizing reversals for the shoulder. Once I find my patients like cricketer, bowlers or the tennis players, once they comes with the rotator cuff tear or weakness, basically they lacks the stability, then and I work with the stabilizing reversals. So stabilizing reversals is all about looking for the static contraction, not exactly static contraction, without relaxation. So let's go and let's just see this pattern now. Yeah. So, we can do this movement in the sitting also, but when we talk about the sports player, we always need to create challenges for them. So we can do like these techniques on the Swiss ball also. Because when we talk about the sports rehabilitation, when we talk about their recovery, we again target on the proprioception, activation of more proprioception actually. So creating more challenges for them so that they could look for the optimizing their functions. So I'm going to take her in the half kneel position. And now if I go for this is flexion, abduction and extension pattern. So if I ask her now, open your wrist and go up. So this goes to my flexion, abduction, extension pattern. And this goes to my extension, adduction, introduction pattern. So between these two patterns, I can work on the stability with the stabilizing reversal. So suppose I take for half, open your wrist and go up. This is the half of the pattern. And now I can ask her to, don't allow me to move you. So what I'm doing now is that I'm giving a resistance, but she's not allowing me to move her hand. And now I'm going on the antagonist muscle. So don't allow me to move you. So it's a co-contraction of agonist and antagonist, which gives a lot of stability and the sense of position of the shoulder to the brain. Don't allow me to move you. 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 Can you get the phone closer? Phone closer? Don't allow me to move you. And don't allow me to move you. And don't allow me to move you. So this provides a lot of stability to the shoulder, giving a sense of coordination stability. Now the same thing. Now to increase challenges further, I can ask her to sit on unstable surfaces so that she has to hold herself over there and then she has to perform this also. So we also do the dual task activity in the PNF for the sports rehabilitation. So again, don't allow me to move you, don't allow me to move you, don't allow me to move you, don't allow me to move you. So we can always work with this also. So this is for the shoulder. Now we are going to talk about, like, I want to work with the golf player or the tennis player when they play with the bilateral and they use their trunk a lot. So to activating the core muscle, to activating the back muscle and the trunk, strengthening that, we use the lifting pattern of the PNF, which is we start with the bilateral upper limb and goes with the trunk patterns. So again, that we can do on the stable surfaces. But once I find that my patient is able to do it easily, I take them again on the Swiss ball to create more challenges for them. So we are going to work with the first chair. So I'm going to ask this and facing this. So we are going to use this for this. So one arm, this arm will go in flexion, abduction, extension pattern, and this arm is going in flexion, adduction, extension pattern. So it's a bilateral arm upper limb patterns which will end with the trunk patterns. So let's go with this. And I'm using approximation principles over here. So I'm giving approximation over the head. So go up, keep going up, keep going up, go up, go up. Look at your arm, look at arm. Yes, stay there. Now I'm asking her to stay in this position, giving a resistance which is going to work on the back muscles by irradiation. And now I'm going to ask her to resist myself and I'm going to put it down. So this is combination of isotonics. Now let me bring it down and now go up now, go upward. So this is concentric contraction, stay. Now this is static contraction, and let me win. This is eccentric contraction. And eccentric training is very, very important with those players and athletes basically. Now, one very important thing I'm going to show you today is Pilates with PNF. So this is something we do a lot with the sports player at our clinic. So how do we use that? Just see this. We have the reformer Pilates, and we are going to work with the upper limb PNF patterns on the reformer Pilates. So it's like a dynamic PNF mobility exercises. Yes. So we are going for flexion, abduction, extension pattern with the movement of the trunk and stability, trying to develop the stability. So this is a dual task activity for the sport player. So go now. Yes. And go. So she is trying to engage her core muscles to stabilize herself in the knee sitting over here on the reformer, moving from the low part and doing the upper limb pattern. Flexion, abduction, extension. Go again. And keep looking at your arm. And down. At the same time, I can ask her to go for flexion, adduction, extension pattern. So yeah. From extension, abduction, into rotation. Go now. Yes. And go up. Up more. Go there. And down. So this is flexion, adduction, extension pattern. Come down. Now the last thing I'm going to show is hold relax techniques, because when we talk about flexibility in the muscles in the sports player, I have not found anything better than hold relax and the contact relax. The evidence suggests is that the PNF stretchings, hold relax and contact relax, are one of the best to get the flexibility into the muscles. So I'm going to show you, like for the hamstring, when we talk about hold relax, contact relax, we can perform these techniques within the patterns or without the patterns. So can I ask you to lie down on this? Now if I want to work on the hold relax of the hamstring, I'm going to work with, so this is the range of motion where I find that it's stiff and it cannot go further. From that range, I'm going to ask her to build static contraction in the opposite of the movement direction. So this is the movement direction. So I will ask her to build static contraction in the opposite of the movement. So can I ask you to press down? And I am going to create resistance to hold this position. Hold for 7 to 8 seconds. Keep pressing. And then asking the patient to relax. Breathe in, breathe out. Relax for 2 to 3 seconds. And then we can increase the range of motion. And now from the new range, I can again go for this hold relax techniques. So that's how we work with the hold relax. When we talk about the contact relax, we develop concentric contraction rather than static contraction. And we have indirect approach and direct approach into the same. Thank you. So I think you guys could see some of the demonstration of some of the techniques. Like I told you that we have hundreds of techniques to work in the sports with the PNF. We combine different patterns of the lower limb, upper limb, trunk, head and neck, thrust patterns especially. Like we do work with the short put player with the thrust pattern, which are very high patterns in the PNF. And we combine again different techniques with them. We use elastic band, we use therabands. When we talk about ACL reconstruction surgery, so the day 1 or the day 2, we do indirect treatment for them with the PNF in the footballers. When they are being asked to give the full weight bearing, we work on their mid stance basically with the PNF, with the elastic band. So I'm not going to show that technique to you today, but maybe you guys can go to my Instagram, Rohit20, Dr. Rohit20. You guys can go to my Instagram, and I have so many videos over there which you can see and you can look at that. D.2 my Instagram. So I put a lot of videos of the sports over there, and I'm going to put that for the ACL recovery with the PNF in the footballer. That's amazing to work with that, and I'm going to put some more videos. So the goal is all about getting them to their performance level, because it's not just about working on their pain, it's all about bringing them back to their normal life, back to their performance. Because we have seen a lot of athletes who have suffered from the pain and the injuries, and who could never return to their sports like they were before actually. So if you use the PNF with them, whatever you are using the other techniques, lovely to work with other techniques, but if you mix the PNF with them, it's going to bring them to the back to their normal routine or back to their normal performance level. So that's my goal to say to all of you. And definitely we use the PNF in different other other conditions in neuro orthopedic and all. So maybe we can chat next time with that on the platform of the Harcon, or from our Movement Science Academy Facebook page, or from Instagram. And it's always nice to connect to all of you. So once again, my thanks to Dr. Mudgil and the team for creating and this wonderful conference, getting the people on the board. And he's been doing excellent work. My all the best wishes to him, because he looks for the profession first rather than anything else. So my best wishes to him, and great, all the best. Thank you all for watching my presentation. Thank you.